and compromise on all of this. Joining me now on the phone is California Congressman Darrell Issa. He is the ranking member of the House Committee on Oversight and Government Reform. Congressman, welcome. Good to have you here today.
Well, thanks for having me on. And certainly there will be bipartisan support if we're trying to get universal coverage for everyone in America that is efficient and delivered properly and preserves the high quality of care Americans expect.
Yep. You know, when I look at what you have to say about this, Congressman, you know, the headline always from the administration on health care reform is that if you're happy with your plan, you're not going to lose it. So if people have that employer-based plan and they like what they've got, they're being told that that is not in jeopardy.
Well, that's disingenuous, I'm afraid, by the administration. Once you offer a federally subsidized alternative, one that is artificially low in any way, shape, or form, even if it's simply a federal system that exempts itself from the normal liabilities that private health care has, it's going to have an advantage. What we've said instead is make the programs that I'm eligible for as a congressman, this high-quality federal private health care, but health care that federal workers are able to access. If you want to bring the federal government in, bring in our privately funded or our private systems that we have. Right now, every congressman enjoys great health care from the private sector, and every federal employee enjoys it. And I've said repeatedly, let's offer those programs, but those programs are private sector programs that cost $7,000 or so a year to be a member of.
Right. You know, there's a couple of issues that you've raised, and President Obama has said that, you know, every American should get at least the kind of program that congressmen and publicly elected officials get. So, you know, talk to people about the difference between what you're suggesting and what he's suggesting.
Well, the program that the postal worker has, that I have, that people in every federal office have, is a program where we get to select from a number of different private providers, including Blue Cross and the many names you know, and some others that are pretty unique to the federal government. Those programs are private sector programs. They have, you know, formularies and all the things to try to control cost. What the president says when he says we're going to have public alternative, this is really more like Medicare. The problem with Medicare systems is the federal government says we're only going to pay $80 even if the going rate is $120, and if it's artificially low, it shifts the cost to others. Well, if we put everybody onto these systems, what's going to happen is it's going to wipe out the private sector. It's going to ration from the federal government.
Yeah,
and
of course.
Delay in service and rationing of service is exactly what Americans are not used to and don't want to tolerate.
And you fear, I got to go, but you fear that employers, if they see that there's a public option, they're going to eliminate their own programs. They're going to feel like they don't have to do that anymore, right?
It's a cheaper program and it's public. They're going to deliver to it. And certainly small businesses are going to say, great, I'm tired of having to deal with this. I'll just dump my employees onto it. And if those programs were normal competitive, I wouldn't be squawking.
Got it.
It can't be artificially low.
Congressman Issa, thank you very much. This is going to be a big, big topic in the week to come. Thank you, sir.
Thank you, Martha. Take care.